Good afternoon and welcome to the COVID-19 update on Channels Television. I'm Millicent Wonka. First, some of the highlights. Today, according to the World Health Organization, Africa, Nigeria among the top 5 countries with the highest number of coronavirus cases on the continent. We review the lockdown ease roadmap across the country. We'll be joined by an entrepreneur and chairman, ANAP COVID-19 think tank at Atedo Peterside. And more European nations begin easing lockdown restrictions. The COVID-19 pandemic hit many nations, including Nigeria, by surprise. But just like most countries, the Presidential Task Force on COVID-19 swung into action, pulling the country together to fight the coronavirus. Around the world, more countries are beginning to ease restrictions, implementing partial lockdowns, and experts have said governments must react smartly and provide greater detail on expected outcomes. Businesses are expected to do all it can, for example, ensure sufficient spacing among employees in accordance with the physical distancing rules and show hand-washing provisions, among other guidelines. And while the world attempts to get back to normal in Nigeria about 4 months after our first index case, what is the progress report? On our theme today, we review the efforts to stop the spread of COVID-19 and the lockdown measures thus far. COVID-19 is still taking a heavy toll across the world, and in Africa, there are over 63,000 confirmed COVID-19 cases on the African continent, with more than 2,283 associated deaths. From the Nigeria Center for Disease Control, NCDC, it puts the total number of confirmed cases in the country at 4,399, while the number of patients discharged is 778, and 143 deaths have been recorded thus far. As of yesterday, 248 new cases were recorded in 17 states, with Lagos having 81 of the cases, followed by Jigawa 35, Borno and Kano states 26 each, Bauchi 20, 13 recorded in the FCT, 12 in Edo, 10 in Sokoto, 7 in Zamfara, 4 each in Kwara and Kebbi states, 2 each in Gombe, Taraba and Ogun states, 1 each in Osun and Bayelsa states. A breakdown of the cases by the region you can see, showing Lagos in the southwest with 1,845 cases, followed by Kano in the northwest with 602 cases. The FCT is the highest in the north central, 356 cases. Borno in the northeast with 185 cases. Edo has the highest in the south with 79 cases. Enugu leading in the southeast with 10 confirmed cases. Now let's bring you figures from Africa. According to the Africa Center for Disease Control, South Africa has the highest number of confirmed cases with 10,015 cases, followed closely by Egypt with over 9,400 cases. Morocco comes in third place with more than 6,000 cases. Algeria has over 5,700. Nigeria is in fifth position with 4,399 cases, above Ghana at 4,263. Overall, 53 countries on the continent have been infected. However, on the bright side, 21,821 people have recovered from the illness. Joining us now on the program is Mr. Atedo Peterside. He's a Nigerian entrepreneur, an investment banker and economist. He's also the founder, Stanbic IBTC Bank PLC, chairman, ANAP Foundation COVID-19 think tank. He joins us via Skype from Lagos. I would like to welcome you. Thank you for joining us on the program, Mr. Peterside. Let's begin by asking, but perhaps first establishing that you've expressed your points of views on the efforts of the federal and state government since the beginning of the coronavirus pandemic. We've had a lockdown in place and it's eased since last week, yet we are witnessing more and more COVID-19 cases. What's your take on the strategies of the government so far?
Yes, I think the government is doing more. The governments are trying, and we're getting better all the time. The testing is ramped up nationally. But I think people confuse one thing, that at the beginning, there was very little testing. So the figures we had at the beginning were probably artificially low in terms of confirmed cases. Now that we're doing a lot more tests, of course, we're also finding a lot more people who are testing positive. So it goes without saying that the more tests you do, all things being equal, the more you will find people in the populace who are positive. But to mention as to how well we are doing, I think it's important to emphasize that a complete lockdown is not sustainable. A lot depends on what you think we're dealing with. Is it a sprint or a marathon? If you know it's a marathon, a complete lockdown is not sustainable. It's not sustainable because people will not cooperate after a while because they will die of hunger. So what the governments have been doing is transiting from early efforts at a complete lockdown to partial lockdowns of a type which can be sustained. And the science is there behind all this because you've got to move to an environment or to an arrangement that you know that your people can sustain, because this COVID-19 fight may last 15 to 18 months. So one has to be very conscious of that and put in place measures that can be sustained at every level.
But there have been certain fears from the PTF, and they've also warned of another lockdown if the guidelines are not adhered to. And so if you're saying perhaps sustaining the lockdown might not be possible, how indeed then do you think that we can perhaps help ourselves, take responsibility, businesses and citizens, and perhaps how can government balance the economic realities with the pandemic fight?
I didn't hear you very clearly, but I think you were asking about how the government can work with the citizens. I think this battle for COVID-19 has to be a joint fight. The government can never do it alone. And also, what we're talking about, don't forget, is getting the whole populace to change their behavior. This is a campaign to get people to change their behavior. And you cannot achieve that in one day or in 1 week. It's something that has to be sustained. There's a reason why the governor of New York is on TV every day. There's a reason why in most of the countries that have been very successful, communications has also been first class. So the truth is that we have to find our own solutions in terms of communication. And it's not enough to just come out and say, yes, you can threaten people that if they don't obey the partial lockdown, you may take them back to full lockdown. But I think we all know that full lockdown cannot be sustained. Let me take Lagos, for instance. Lagos cannot feed itself. So you can never have a complete lockdown. The reason they could have a complete lockdown in China, in Wuhan, was because the rest of China or the Chinese government could deliver everybody's needs to their front door. If you can deliver everybody's needs in terms of food, provisions, and healthcare to their front door, then you can have a sustained lockdown. But in Nigeria, we're always beyond us. So I think what the government is doing, well, it's good to remind people that you're giving them some freedoms which you can pull back. But you cannot pull back all those freedoms completely, because at the end of the day, the only lockdown that you can sustain is one that has the cooperation of the people.
Well, Mr. Putisad, when you hear of the projections from the model of the Lagos state government saying that in July we might be having 90,000 to 120,000 cases, looking at Lagos as an example, don't you think that a lockdown might reduce those projections?
Yes, you see, let's be careful. I keep on saying that when you use words like lockdown, I keep on saying that the only lockdown that you can have is partial lockdown. I think what Lagos State is warning us about is that this is not going to be something that we think we can resolve in a few weeks. The cases will keep on rising, whether it's 90,000, 100,000. The important thing is that we have to make arrangements that make it possible for us to manage those cases. I give you an example. Let me go into some details. I don't know, what we're trying to do is to avoid people infecting each other. If you really think about that, how to avoid people infecting each other, You want to keep them physically apart by about 2 meters. Then there are some things we are doing that almost contradict that. For instance, the curfew. What the curfew achieves is that it puts everybody under pressure to come out at about the same time. Businesses to begin at 9 o'clock, end by 3. Everybody is trying to run away. And when they are open, you get crowds gathering. I think that sometimes less is more. If you want people to come out and do what they have to do without infecting each other, then you've got to lengthen the business hours. You've got to make the curfew less restrictive so that some people can come out early in the morning, some can come out late in the evening to do their shopping and things like that. But forcing everybody to come out at the same time through curfews and short business hours can almost be counterproductive because you're forcing them to meet each other as they try and take care of their needs in a short period of time.
And your think tank proposed the lifting of the curfew between 11 p.m. and 5 a.m. You say no more than 6 hours to help ease overcrowding. Some people say putting it to as high as 11 p.m. for what we have now at 8 p.m. might mean that you cannot control people's tendency to perhaps use such hours to also gather and socialize. But I also want to draw your attention to one of the recommendations you made. You said lengthen business hours and reserve 1 or 2 hours exclusive service of the elderly. If we look at the way the banks resumed during the ease of lockdown, a lot of people said that it was appalling as there were no physical distancing measures. And if you're saying we should have this amount of time for the elderly, what about their transportation, to and fro their homes?
Yes, I think, the more you shorten the hours for everything, including transportation, the more you lead to crowding in that public transportation. So that's why please, when we talk about trying to make the curfew from 11 p.m. to 5 a.m., it is just a suggestion. Please believe me that in normal times, Lagos wakes up well before 5 a.m. When we're talking about business hours, we forget all the activities that have to take place to make it possible for goods to be available in the markets. It's partly about route to market. It's partly about also supply chain disruptions. If you tell somebody to open his stall at 9 a.m., there's a whole range of activities that takes place hours before that ensures that by the time you arrive at 9 a.m., all the goods you're looking for, fresh produce, is available. So by having a restricted curfew, you're making those things difficult. I'm talking about the elderly. Please, this is borrowed from a few countries. Yes, when you look at the banks and the congestion that we saw in the first few days after the lockdown, it was frightening, it was worrying. But I think that was partly because not all the bank branches were open. And then even when they were open, the hours were restricted. So we are saying that if in normal times banks open at 8 a.m., why do you want them now to open at 9 a.m. instead? Why do you want them to close at 3 instead of 4 o'clock? If the normal hours are from 8 o'clock to 4 o'clock, then keep those normal hours. And if anything, reserve 1 hour or 90 minutes in the morning for the elderly. The reason being that the elderly are the ones who are most vulnerable to infection. If you make them come in to compete with everybody else when the banking halls are crowded, it's a little bit unfair. So in some countries, they give them priority and earmark some hours for them so they can come in, hopefully, without crowding, take care of their little needs and go away. So all we're looking at is ideas to fine-tune and make it possible for us to sustain all these arrangements in a clever way. And also, I will point out that we also have to be up to date with the science. The truth is that people get infected most. The studies have shown that, recent studies, people get infected most when you put them together in a closed environment and you don't have enough distancing. So indoors is a lot more dangerous than outdoors. Outdoors, to an extent, I suppose the virus has so many ways. The wind can blow it away. There's no confinement. Indoors, you're breathing recycled air. So you have to be very careful how you crowd things like banking halls and any hall or shop or mall that has people inside breathing the same air. the open markets are a little bit better. So the argument for saying the open market should open for longer is so they can get their supplies in easily and make all the arrangements for the supply and resupply during the business day, and to make it easier for people to come and shop or come to market at different times the whole day long. If you elongate the marketing hours or the shopping hours or the banking hours, then you also put less pressure on public transport, because anybody trying to use public transport to get to the banks at 9 o'clock and to leave by 3 o'clock is what causes serious congestion. And in those congested buses, even if you say they should not operate with a full crowd, the truth is that the curfew puts them under pressure, and people in a bid to get home end up crowding the buses in a bid to get home. So I think what we're saying is that let us understand the problem, let's understand the science, let's understand the constraints, and let us begin to modify them slightly in ways we.
All right. We appreciate your time, Mr. Tedo Pisasai. Thank you so much, Chairman, founder, COVID-19 think tank, ANAP. Thank you for joining us.
Thank you.
Still to come on our COVID-19 update, we have more from the states and the measures to curbing the spread of COVID-19. Join us again. Welcome back. Kano State over the weekend discharged 10 COVID-19 patients undergoing treatment in its isolation centres, bringing the total number of patients successfully managed and discharged in the state to 32. The State Commissioner for Information, Malam Mohammed Garba, announced this, said that the patients have fully recovered, testing negative twice to the virus. He also said the state has recorded 3 deaths yesterday, which brings the number of fatalities from the virus disease to 21. An initial batch of 210 Almajiri children who were deported to Kaduna from Kano, Gombe and Plateau states and quarantined for testing for COVID-19 have been sent back to their respective local government areas for onward reunification with their families. All the 210 Almajiris tested negative after they were quarantined for 14 days. And the Kaduna State government says the children will be returned to school, where they will continue their education in their localities. The Commissioner for Human Services and Social Development, Hafsat Baba, while handing over the children to the Permanent Secretary in the Ministry of Local Governments, restates the commitments of the Kaduna State government to the education of the children. And Taraba State government is making sure that food items, medical consumables are distributed to the poor and vulnerable in the state. The deputy governor, who inspected the various food items deposited at the warehouse of the state's Transport Corporation and veterinary clinic stores, says the effort is to cushion the effect of the lockdown on residents occasioned by the coronavirus pandemic. He explains that the palliatives are donations from the federal government Northeast Development Commission, as well as the Victims Support Fund.
The governor wants to be as transparent as possible. He said we should all sit down together and then share these items equally across the 168 wards we have in Taraba State. And that is what the committee have done. We want this item to get to the grassroots, to get to the most vulnerable people in this state. The governor have directed that we should do this across party lines. And we're all here together, and we are going to share these items together to our people.
To Cross River State, where the governor, Professor Ben Ayade, is calling on the federal government of Nigeria to review the option of halting air transport for another 4 weeks in a bid to contain the COVID-19 pandemic. According to the governor, it will have a negative toll on the socio-economic sector of the nation's economy, as many businesses may fold. The governor was speaking at the Ayade Industrial Park in Calabar, the Cross River State capital, where he recommended the NCDC come up with some guidelines to allow domestic flights begin operations while meeting security, safety standards to keep passengers and other staff safe from contracting the virus.
Finally, once more, plead with Mr. President to kindly review the option of keeping the Nigerian airways closed for another 4 weeks. The hotels are dying. Hotels are laying off workers. Food suppliers, vendors are laying off workers. The country is awash with massive unemployment occasioned by this lockdown. An additional 4 weeks will deal a very great blow, and some of them will never be able to recover. When a hotel is locked down for 1 month, most of the air conditioners will pack up. The cost of refurbishment, restarting, will be just too huge for some of them to be able to survive. I plead with Mr. President in his generosity of heart and kindness as a leader of these people in Africa, the leading country in Africa, that we should take the risk, because there is really no risk, to insist that NCDC will come out with a protocol to allow for the domestic flights to commence operations while meeting certain security and safety standards to guarantee that we keep our people safe while the domestic businesses thrive.
And the State Commissioner for Health, Dr. Wahab Adigbenro, confirmed earlier today that in Ondo State, a patient is said to have died while on admission at the isolation center. Currently, 15 cases of COVID-19 have been recorded in Ondo. 6 out of the 15 tested negative and discharged from the isolation center, while 8 are under treatment, and sadly 1 has now died. Nasarawa State government has received palliatives from the federal government. The Deputy Governor, Mr. Emmanuel Akabe, who received the truckload of food items, disclosed that distribution will begin from Nasarawa local government area, which is currently on lockdown. Elsewhere, the Adamawa State COVID-19 Containment Committee has expressed concern over the non-compliance to the order announced by the state governor on the use of face masks and other measures aimed at preventing the spread of COVID-19. The Adamawa State Commissioner for Health and Human Affairs said this while giving a situation report on activities of the Containment Committee for the week. According to him, 157 suspected cases were tested in the state, out of which 15 were confirmed positive. No death has been recorded and none discharged yet. Well, let's go to our correspondent Hajara Ali, who is joining us from Bauchi State for more updates. Hajara.
Azare town appears to be the epicenter of the recent outbreak of the coronavirus in Bauchi State. Yesterday, the Bauchi State government was forced to impose a lockdown on 3 local government areas as a result of a spike in the number of cases due to community transmission. More than 70% of the health workers that have come down with the coronavirus are also from Azare town. Let's get reaction from people about what they think about the total lockdown that has been imposed. I'm here with Barrister Hassan. Barrister, what do you think about the lockdown, total lockdown in Azare town?
Well, to me, it is a good step in the right direction. Like in Bauchi local government, the spread of COVID-19 is not as much as that of Katagun area. But I think with this issue of total lockdown now enforced by the government of Bauchi State, the government will be able, with absolute certainty, to ascertain the number of people that are likely or that are infected, so that at least they will be quarantined and isolated. And they will also use that opportunity to engage in sensitization campaign, because by that time, almost all people will be at home. They will use through the media and other means to communicate to people how this disease, how deadly, how dangerous these diseases are. Because some of our people still don't even believe that there is this coronavirus until when they are tested. So I think it's a good step in the right direction.
Thank you very much, Barrister. So for now, 17 local government areas are still on partial lockdown. Some of these measures may have to be reviewed if the number of cases keep increasing. From Bauchi State, Hajara Aliyu, Channels Television.
Thank you, Hajara. And from across the globe, lockdowns are slowly being eased across some parts of Europe. In France, people are able to walk outside for the first time in weeks without filling in a permit. The reports out of Paris suggest parts of the public transport system are struggling to maintain social distancing. But one thing is for sure, there are a lot of people around the world wearing face masks. Take responsibility in protecting your health. The NCDC has shared measures put in place as part of ways to easing the lockdown. The website, also the World Health Organization, has live updates on the pandemic across the world. That's our COVID-19 update at this time. Another update comes your way again at 6 p.m. I'm Millicent Wonka. Stay safe. Bye for now.